Good evening. I'm Jenna Doherty from Abbott, the global healthcare company. I'd like to thank the Chicago Council on Global Affairs and everyone in the audience for joining us this evening to celebrate the vital work of improving lives and health. The documentary, Bending the Arc, as we've all just seen, chronicles the journey of Partners in Health. 30 years since its inception, Partners in Health is now operating in 10 countries around the world, tackling entrenched diseases and global epidemics, engaging others to do the same. Their efforts are close to our hearts at Abbott because for nearly a decade, we've had the opportunity to see firsthand through our partnership in Haiti. Expert volunteers from across the company, many of whom are here this evening, have worked shoulder to shoulder with Partners in Health and a Haitian team. Together, they've helped fight malnutrition and expand economic opportunity in Haiti. But I've heard from our volunteers that they've gotten more out of it than they've put in. They're all energized about the possibilities of finding new answers to challenging problems, which is exactly what Partners in Health has been doing for many years. And now we'll get to dig deeper into the story. I'd like to introduce tonight's esteemed panel. Dr. Paul Farmer is the co-founder of Partners in Health. He's the Cola-Coturnes University professor and chair of the Department of Global Health and Social Medicine at Harvard Medical School. He's the chief of the Division of Global Health Equity at Brigham and Women's Hospital in Boston, and serves as the UN Special Advisor to the Secretary General on community-based medicines and lessons from Haiti. But as you saw in the documentary, Paul is so much more than a resume. He is a visionary who poured himself into the cause that others thought was futile. By saving lives and inspiring others, he provided a roadmap for approaching global health a different way. We're here today to honor him and to hear more about his story. Sitting beside Paul is Corey Shepard-Stern. Corey is an Academy Award-nominated producer and is the producer and writer of that fantastic film we just saw, Bending the Arc. She also has hands-on experience as a social change strategist and entrepreneur. She has appeared in the Sundance Grand Jury Prize and Audience Award-winning documentary, Sunita, helping a young woman escape child marriage in Afghanistan. And the moderator for tonight's discussion is a voice that is familiar to many of you, Steve Edwards, the Vice President and Chief Content Officer at WBEZ. Steve recently returned to public media after spending 5 years at the University of Chicago's nonpartisan Institute of Politics, where he served as its executive director and oversaw the development of the Axe Files podcast with CNN. He previously served as WBEZ's content development director and as the host of the station's acclaimed news and culture programs 848 and The Afternoon Shift. Now, I'd just like to say this portion of the program will be on the record and will be live streaming only the panel discussion, so please silence your telephones. Views expressed by the individuals we host are their own and do not represent the institutional positions of the council. With that, please join me in welcoming our speakers.
Jenna, thank you so much for that introduction, and to Paul and to Corey, thank you so much for the extraordinary work and the extraordinary film that brings us this story. A round of applause for both of them again. I want to get into the work, the implications, and the challenges before us now, but just to connect the two of you in this story, which is powerful and inspirational. Why a documentary? Where did this relationship and this project actually come out of for each of you?
Well, actually,
Vindication is about to occur. Nerds rule.
That's right. Years ago, I was a television producer on the run. I left my job in children's television, doing the Power Rangers. Thank you very much. And
Nice.
I was in Nigeria, as Paul says, as one goes to Nigeria. And it was in the middle of the AIDS crisis, where people were just dying everywhere. And I was part of a group of people. We were collecting medicine from West Hollywood, and our friends who were changing their drug regimens, and we were carrying it over to friends in Africa. And people were saying, well, there aren't enough doctors to give meds, and I'm a producer. Like, you've got to solve the problem. You can't just be like, well, sorry, we can't get the shot. You got to get it. And so I started looking around for, is anybody training just normal people to give these drugs? And I stumbled across this paper, the HIV Equity Initiative paper in the Lancet, the hoity-toity journal, and I thought, who is this guy? He's pretty smart. What's this guy, Paul Farmer? And that's how I first heard of Paul.
You hadn't heard of me at Fox News.
That's right, exactly. And that's when I first, Paul was definitely on my radar at that point. Like, okay, this makes a lot of sense. This is smart. This is going to solve a problem. This is like, yes, this is what you have to do. And, there just wasn't enough time to go train yes, we all need doctors, but there wasn't enough time. And so that's how I started. And then later, I read Mountains Beyond Mountains. I was like, that's that guy again. And I contacted Tracy Kidder, who wrote that beautiful book that I'm sure so many of you have read. And I was like, I'd love to make a movie of this because I have all this amazing experience with Power Rangers. Surely it'll translate. No, by that time I was doing other projects as a producer and a writer. And Tracy said, oh, Paul will never want a film made. But here we are. It happened. And so ultimately they were interested in a documentary, and that's how it happened.
And Paul, for you, what was it that made this project worth your investment of time?
Well, I don't want to sound sycophantic, but it was Corey. Because Tracy was right. I felt like I already gave at the office, and the idea of having a film crew hang around with you is bad enough having Tracy. But people with saying things about the boom mics, the things that look like a dead rabbit or something. I mean, you know this world, Steve. Lavaliers and boom mics, and it was right after the earthquake when we met. I mean, days, and it was a terrible time to meet. And I had a private conversation with Corey saying, look, the history can't start when you get involved, right? There's a quarter of a century we've been working on this, and there's an archive, and there's other footage, and she said, if it's out there, I'm going to find it. And I thought that was maybe a way of making her go away, but she did. And we've been friends basically ever since that terrible time. And she's just dogged and scholarly and wrote it the way she wanted to. I didn't see it until right before Sundance, so. But I already knew we were friends, and we saw things the same way, even as regards reading the Lancet. Power Rangers I missed.
Well, there's so much in the film that I want to pick up on, but let me start with something that you said relatively later in the film. The idea that Ebola itself wasn't just an outbreak that represented the natural course of a viral outbreak. This was a failure of a healthcare system. What do you mean?
Well, I mean, I spoke with some members the member of the council about this earlier this afternoon. I went into this field, the clinical part of infectious disease, but my academic work is also on how epidemics mow through populations or don't. So, infectious disease dynamics. And that wasn't the subject of the Lancet paper, which is how do you treat people once they're already sick. But whether we talk about Zika or chikungunya or cholera or Ebola or even HIV disease, these are all tests of the strength of a healthcare system. And, our country, for example, has a very disorganized healthcare system. But there was no way there were going to be hundreds, much less thousands, of secondary cases of Ebola here. It wasn't going to happen in Europe. It wasn't going to happen in the better organized parts of Africa or Asia. It happened in places that were clinical deserts. And if they're clinical deserts, they are also public health deserts. So that's always been the story with Ebola. That's always been the story with its cousin, Marburg virus, these scary hemorrhagic viruses. They spread where there's no opposition with the right stuff, space, and system. So who are the primary caregivers? The poor themselves, family members. Who's most at risk of Ebola? Those who take care of the sick, nurse the sick, and when they fail, perform the last act of caregiving, which is burying the dead. That's how Ebola spreads. Not eating bush meat, it spread from human to human in settings where there was not a healthcare system. So we can't declare it over until we go back and build the healthcare system.
Yeah. I mean, this film tells the story of battling the forces of whether it's governments, big pharma, et cetera, to raise awareness around a number of massive health crises. The question, I guess, that still lingers for me is, to what extent are we as a global health community, as a community of intergovernmental organizations, international bodies, learning the lessons from the response and problems that grew out of Ebola, or the complete lack of coordination around and investment in HIV early in the outbreak of that epidemic?
Well, I think if we're learning the lessons, we're forgetting them awfully quickly.
Yeah.
And it's very fashionable to go right to people outside your field. For example, big pharma. But that's not what strikes me in my own work in this community of global health. Yeah. Of course, I'm not talking about the people in global health inside the research-based pharmaceuticals. There's better be focusing on global health and health systems. I think they've signed up for that, right? But the real problem, as you can see from the film, the really debilitating part of this is that it's actually your own friends and colleagues who are saying it's not cost effective, it's not feasible, it's not sustainable. Patients never say stuff like that. Yeah. I don't hear it. If I hear it in a pharma company, it's going to be from the expert on public health, right? And then authorities who have some sense of responsibility. They're not all going to be like Dr. Agnes or Paul Kagame in Rwanda, but they also are not to be blamed so heavily for failures because they just don't have the staff, space, and system. So getting it there requires this can-do Power Rangers producer sentiment of how are we going to fix this? Yeah. And that's really our overlap, because that's how we see things as.
Yeah. Well, Corey, you and I had a chance to talk a little bit beforehand, and one of the themes that you highlighted from the process of doing some of this work and the film is this sense of the role of government and the public sector in this, which is often highlighted negatively. But how do you see that role and that interplay?
Well, as you know, I am passionate about that piece of it because, as Joya says in the film, governments can't deliver on human rights. If healthcare is a human right, NGOs don't deliver on human rights. Your good friend, the government delivers on human rights. And so it is so important. That's what PIH does. That's such a point of difference. I bless the poor Uber driver's heart yesterday when she said, "Oh, your film, is it about Doctors Without Borders?" And I was like, no, they're totally different. Not that there's anything wrong with them, but it's about partnering with the government to build the system back, or to build the system where there was none. But in a lot of cases, it's like I see that a lot of what Partners in Health does, I feel like it's a reversal of this structural violence, a reversal of what's been done to these countries. This idea of putting it back into the government instead of taking it out, which is what so much of that World Bank 1981 stuff did. And then there's the whole history behind it, colonialism and everything else. But I do think that building a strong, the government is the will of the people, and yeah, so it is very important. I'll stop there, but you can talk to me afterwards.
I just think sometimes if you just looking at one's own biography, and you think about yours. I mean, by the time I was 18 and headed off to Duke, and then Harvard, and then the Brigham and Women's Hospital, right? I mean, these are fantastic institutions, right? I always saw them as fantastic institutions, each one. But you don't have a right to go to Duke, or a right to go to Harvard Medical School, or a right to match at the Brigham as a trainee, you know? And then I thought, yeah, but I did have the right to go all the way through school till high school. How come they don't have that in Haiti? How come? So if you're gonna think about public health, you know, you have to think about the public sector, whether you're from the private sector or not. And Abbott's from the private sector, and Partners in Health is from the private sector. So is Harvard and the Brigham. So is Corey's production company. But we can contribute something to this broader, long-term goal of saying, you know, people ought to have the right to not die unattended of an illness, or die uneducated when they want desperately to learn how to read and write. And that's not too much to ask, you know.
Yeah, and to build on that, so often we think of like what the government is, but the government is the us. And you have to support the us. I mean, that's how I feel about it. I was actually living in Liberia when we started filming. It took 5 years to get the rights, and then we closed on the rights just before the earthquake in Haiti. And we flew,
Getting the rights from
Yes,
Partners in Health.
from
So played hard to
Partners in
get.
Health.
Sorry.
Played hard to get, okay.
Yeah, from Partners in Health. And we closed on the rights just a few days before the quake and landed in Haiti just after the quake. But I was living in Liberia, and PIH was not in Liberia yet. And it was a complete nightmare for healthcare. And my children are Liberian, and it just seeing the government struggle, and they had so much debt that, you know, they never borrowed that much money. I mean, it was like loan sharks, and just see them struggle. And, there's this idea that, governments are too corrupt, and just, that's lessons from Haiti. If you go on the Lessons from Haiti website at the UN, you can see how that's not a real obstacle. I mean, it's a small piece of it, and Paul can speak much more about that, but that's...
Why do you say that's not a real obstacle? Because
Paul?
it's often cited as critical.
Yes.
Most of after the earthquake, most of the pledges and the aid didn't go anywhere near the government. First of all, most of it wasn't transferred at all, which was a kind of shocker the first time I went to a pledging conference, which was before the earthquake. And then if you have Haitian institutions that you'd want to reinforce, for example, the primary interlocutor for Partners in Health in a place like Haiti, or any of the other places you saw, is the Ministry of Health. On January 10th, I always get the date wrong, and my brother says, ooh, psych. On that horrible day, the Ministry of Health, which is 5 stories tall, collapsed to 1 story. 20% of the public servants in healthcare were killed or maimed. And there were very few of them to start with. And that's what's happening in Sierra Leone, and that's what's happening in Liberia. So if the majority of the money doesn't go through, and you can say, well, but if they're incapacitated and the Ministry of Health has fallen down, how are we going to work with them? But we're just saying change the tone and saying, how do we work with them? You know, it's not, hey, can we do this? Is it feasible? Is it sustainable? Is it cost effective? We say, how do we do this? And that's what the Rwandan said. It's like, how do we get here? And that's the right attitude with this kind of work. How can we do it?
That is thinking about what's possible, right? What's needed, what's possible, setting the bar high in the case of Rwanda as well.
In the case of any place that's been trashed for long years.
Yeah. There's another piece of this. We talked a little bit about the government, but the accompaniment model. Why is that such a central part of your model? What does that do?
Well, you know, I learned this from the Haitians, again, and some of my Haitian colleagues, including the director of PIH Haiti for many years. Loon Bio is here.
Yes,
and she's
call
the
out
one
Loon?
speak.
Loon?
Where are you at?
Stand up, Loon. She should be on the
Yeah,
stage.
well, this is one of the great heroes of all times, and certainly one of mine. She's the one speaking when she allows the accompagnateur to describe accompaniment. And, you know, I heard it from the Haitians around the technical intervention of supporting patients facing not just disease, but poverty and other forces through chronic illness. That's how I heard about it. But then I started reading liberation theology, and largely from Latin America, and one of my theologian friends is here tonight, Jenny Block, who's taught me a lot. And thought, wow, this concept is elastic, but not too elastic, because accompaniment, when it's over, gets to be determined by the folks being accompanied, not the weary accompagnateur, right? It's when they get better or don't need you. And that's, to me, very different from the contractual approach to development work and humanitarian aid, which, you know, I'm sure it has its places, but not in addressing these weaknesses of the healthcare system. That requires an open-ended, ongoing commitment to institutions, just as accompaniment of a patient requires an open-ended, ongoing commitment to that patient.
I want to take questions from those of you who I know have questions for Dr. Paul Farmer and for Corey as well. But as we take questions, we'll have your hands up. We've got some microphones that we can pass. Let me just throw one more into the mix here. And that is this idea of a mindset shift, right? This idea of healthcare as a right, this idea of what's possible. Also thinking about healthcare not as, and medicines and the access to a public health system, not as peripheral but central, not as a province of the wealthy but available to all. How much progress do you think we're making in a mindset shift?
Well, you know, I would say that healthcare as a right, I'm perfectly comfortable with that framework, right? But I'm not out to try and win an argument. I think I could if that were my intention, right? But I don't care if people want to adopt that framework. There are plenty of others. For example, when Jim's at the World Bank or when I'm speaking to a head of state, and there were a couple who were visible in the film, right? You don't have to say, hey, healthcare should be a human right and give some boring lecture. You can say, if you don't invest in healthcare, you will not have economic growth. Yeah. You will not be able to prevent, you know, if you don't invest in girls' education, you will not have development. If you do not invest in prevention and provide care, people will not go to the system when they're sick. So there's plenty of ways to discuss it. And a third way, you know, so there's health as a human right, the development mantra, which is fine with me. I'm shameless if it gets to the same goal. And there are plenty of others, like public goods. Public health is a public good. Yeah. TB, airborne. You see what happens when you don't stop airborne epidemics, when you don't invest in irrigating the clinical and public health desert. So how far have we come? Well, if you add up those three paradigms, right, and you're given to optimism, I hope not psychopathologically so, then you see progress, right? Because if, first of all, universal coverage, which is very much discussed, it's an insurance notion, it's very much discussed around the world. The United States may be behind in that, but that's, you know, we're ahead in other things, right? And there's lots of work to be done there. If you look at the idea that Corey laid out, you know, of you can't be worrying about healthcare and education when your economy's in a shambles. So in other words, pitting investments in healthcare and education against economic investments, we now know that's wrong. It's even, I mean, the World Bank is now a leader in trying to say that was wrong. We should not ever do that again. Investments in healthcare and education grow the economy and grow human, or allow humans to reach their potentials. And then you throw in the public health stuff. People understand, especially with, I think more and more with these epidemics, that stopping them where they start is the best way to go, and that's not going to help happen without watering the clinical desert. And so I think we're making progress.
Let's take questions from, Corey, did you want to add?
No, I just said the arc is bending.
The arc is bending, yeah. What questions do you have? Let's see, looking for hands. We got a hand down in front here. We'll get a microphone over to you. Bear with me 1 second. We'll ask you, keep your questions short and to the point if you don't mind, so we can get to as many of you as possible.
I've been very active with the World Bank and the Civil Society Organization and in Haiti, and I'd like to hear more about Dr. Kim's involvement in World Bank in bringing health care and ending global poverty as you see it with Partners in Health.
Talk about Jim's role at the bank.
The difference that he's made, perhaps, is that right?
Right, and
Yeah, well, you
how
know,
you're applying it.
as he says in this film, and I think it was a prudent thing to say, this change, this sea change in understanding that healthcare and education are not in competition with economic growth, right? That began before he was there. And I would say that for the historically minded, which Corey obviously is, we have plenty of data to suggest that the harshly defined and imposed structural adjustment programs that weakened already weak bureaucracies for the provision of healthcare and education, that they had grievous and negative effects. And you know, whether or not we're trying to win an argument or not, we still have to see some of those policies reversed. What would they look like? I think they look a lot like some of the things that Jim and others there have been proposing. A focus on, for example, if you compare Rwanda to Sierra Leone and Liberia, then you just say, okay, what fraction of the public budget of these three countries is going into healthcare and education, social services? And it's very high in Rwanda and very low in both Liberia and Sierra Leone. And Sierra Leone in 2013 had the highest rate of GDP growth in the world. Liberia, throughout the 70s, behind Japan. So there's no way to tell from GDP growth whether or not they're irrigating the clinical and public health desert. But Jim has just launched, you must know this, a new kind of grading system that would attempt to do just that, to find out which governments, I mean, Nigeria, no, right? Rwanda, yes. And to, you know, to give a report card almost on commitment for the development of human capital, right? And I think, again, that's an example of sticking with preferential option for the poor, which is not World Bank language, right? That comes from theology. But Jim is a believer that you should make a preferential option for the poor. And he's, you know, as a leader, trying to keep steering the ship in that direction.
When you say preferential option for the poor, what do you mean exactly?
I was hoping you wouldn't say that.
Yeah.
I told you my theologian friend is here. Where's Jenny Block? You know, I have seen, I wrote a book about this, so I should know better, with Gustavo Gutierrez, who's a Peruvian priest, who unfortunately in this book, at the end there was an interview, and I said, he kind of looks like Yoda. And Father Gustavo probably didn't know who Yoda was, but he laughed politely. Preferential option of the poor. How about this? Look, God loves everybody. He or she is immanent and able to do such things. We humans have sharper limitations. Given that, who's he or she loved the most? The poor. How do we reflect that in trying to learn about their lives? Well, listening to them would be good, as Loon said in the film. And imagine, even as an idea, that we were saying, well, you know, we're going to make sure everybody has access to education and healthcare, but we're particularly concerned with the poor. They're our number one priority. And that's a good thing to imagine, right? Because it's just the opposite that prevails. Now, Rwanda, again, uses World Bank language, not liberation theology language. But when they say the majority of our investments will be for the bottom quintile, they mean economic quintile, the bottom 20%. I'd call that a preferential option for. It'll be women and their children. Well, that still matches with preferential option for the poor. It'll be genocide survivors and widows, again. So the language may be different, but targeting your services to the most needy and vulnerable is, alas, all too rare in both healthcare and education.
Yeah. Other hands, other questions here? Looking around. Don't be shy. We've got a hand up top. Yes. Or yeah, right down here in front. Sorry, forgive me, the lights are a bit glaring.
Hello, I'm a public health student, and I had a question about Haiti in regards to the cholera outbreak, which was like one of the fault was from the UN. And so for my question to Dr. Paul Farmer is that what are you doing in terms of like trying to, provide treatment for people there who are just devastated by the cholera outbreak in Haiti?
Well, I mean, Partners of Health is providing, in the first few years, treated 70,000 of those patients, right? And I would imagine, I don't know where Doctors Without Borders is, because they're more of a short-term in and out organization, but of course we're still there. There is in the Central Plateau, so from the border of the Dominican Republic across the country to the coast. But it's not everywhere. We also work with policymakers in Port-au-Prince, the Ministry of Health. We've worked with groups in other parts of Haiti, including Port-au-Prince and in the south, in a place called Fondé Blanc. And we launched the first effort to vaccinate people in Haiti using an oral cholera vaccine. And that worked, again, because like the Lancet story, Steve, which is my favorite all-time story, told you we should be writing those articles, right? So that's the job of Partners in Health, is to do the work, but to document it. And that's been taken up recently in Sudan and other settings where there are big cholera epidemics. So, and I have my own personal engagements with human rights organizations that are doing more. They're taking a legal approach to this, right? But you would expect a medical organization to take a caregiving approach to try and prevent cholera, and since we failed, to take care of people and reduce that, it's called case fatality, as you know from public health, reduce that to zero, so that people may get cholera, but nobody dies.
What's your biggest concern and your biggest priority right now from a global health standpoint?
If the rules of the game were changed so that you needed to show in this work that you are working to build long-term capacity, right? If you are working to have your own overhead be low, you are working to remember that people need public health and public education, right? And that you are taking on the tough stuff, that you are going for the equity agenda, meaning rural more than urban, poorest more than less poor. If the rules were rewritten, then our primary problem would not be the one that it is, which is money. Mm-hmm. That's what keeps me up at night. It seems to me absurd to let these programs slide in any way because we're battered by this logic of, sustainability, cost effectiveness, whatever. These are not scientific arguments that are being made. Like sustainability is an ideological construct, right? And so is cost effectiveness. There's not even scholarly work on the difference between cost and price, which even a non-economist can figure out. So to let that logic or our own weariness determine how fast we go is a mistake. And those are the two most common mistakes I hear in our work. One, you're trying to do too much. That's a psychologically plausible argument, but it's completely ridiculous empirically. It could not be true. And two, you're trying to move too fast. Again,
You're talking about Partners in Health specifically.
Internal. Yeah.
17,000 people, 10 countries. You can't do it all. You need to
slow down.
Measure your pace.
Yeah, measure your pace. It's like psychologically plausible, but empirically impossible. You cannot be trying to do too much for the poor. You cannot be trying to move too fast for them. At least there is no historical example of that ever happening. So why don't we keep trying? Thank you. Why don't we keep trying and say we're tired, say we're frightened. Anybody who isn't frightened of Ebola is out of their minds, right? But don't say we're trying to move too fast, and don't say we're trying to do too much. Those are the things that keep me up at night.
I mean, one other thing on the money point, because it's come up historically time and again, and economists would point out scarcity and not on supplies and trade-offs and all those kinds of things. So what's the case that you make to say that we're thinking about it the wrong way financially? Beyond, not on a moral level, but on an economic level, right?
See, you got me there, Steve, because I tried that already and failed.
Yeah.
So if someone would say, by the way, anybody in this audience that have said this before, here, when someone says, yeah, but we're living in a time of limited resources, it is not advisable, but nonetheless true, to respond, yes, but they're less limited now than ever before in human history. But that's not the point they're making. They're saying, we don't want to do this. We don't think it's scary to us or irritating or something. It's not really an honest question like, you know, when we're in, you know, with such limited resources, like, well, that ends the argument. And that is indeed the point often of those comments, is to end the argument, to stop the discussion, right? So that's not a good way to win. It may be a good way to win an argument and look like a smarty pants, but since that's not the goal, but rather to bring more and more people on, you say, just look at the numbers. Like this hospital, the one in Mirabale, for example, which was really the people of Chicago, our supporters here in Chicago. You know about Abbott, but there are a lot of people here. Marjorie Benton is one of them. You probably know her quite well. But number of companies and a lot of community organizations, again, many individuals said, we're going to help do that hospital. And you look at the cost. I mean, it's tiny per square foot. It's right after all Haiti's teaching hospitals were destroyed. And yet that same logic. Well, it's not a priority. It's not sustainable. It's not feasible. If it's not a priority after all of Haiti's teaching hospitals are destroyed in one day, when is it ever going to be a priority? But again, that's trying to win the argument, and that's not, like that rude comment I made at that conference. I'm ashamed of that. First of all, I wasn't talking to that mild-mannered economist to my left. It was someone who said something really quite outrageous and profoundly sexist and I think racist from the audience, you know? So Corey knows that. When she told me she found that, I went, But, you know, it's not about winning an argument. But that was set up that way. But I'm much more interested in bringing people on board, and that's it. Look at the numbers. This is cheap. It's very expensive to do it the wrong way, and we'll learn things for the United States because we know here in this country that it's very costly to give poor quality medical care to poor people in a rich country, which is what we're doing.
Let's take another question here. I think we have one or two up here, if somebody's still up on the top.
Hi.
I'm one down here. We'll do two questions really quickly and we'll wrap. Yeah.
Okay, so I'm an MBA student and actually first generation Haitian American. I got to say your Creole is fantastic. But I wanted to know.
Thank you, young man.
What you think about the impediments that corruption plays on getting the funds where they need to be and those kinds of economic incentives, and how do you get around that, especially in a high corruption country like Haiti?
I'm going to have you hold that really quickly. We'll get
That's
a second
terrific.
question. You can respond to both. So there was a hand up over here in the corner. I'm going to get you involved, and then we'll take both of these.
Hello, my name is Nikoi, and my question to you all on the panel is that do you actually believe that those individuals who opposed you actually believe what they were saying? Their logics, was it really out of morals or was it just out of greed?
Well, you know, first of all, I'll start with that awesome question. What's your name?
Nikoi. My name is Nikoi.
Nikoi. And what's yours?
Dwight?
Yeah. Come on, Dwight's not a Haitian name. That's an American name. No, I'm kidding. Chicago was founded by a Haitian, as you know.
Yes, yes.
The DuSable Museum of African History. Yo, dropping the knowledge. You know, I think, first of all, I have no interest in trying to assess people's motivations. I shouldn't say I have no interest, right? But my best-selling books are in medical anthropology. That's my field. And you learn pretty quickly, I think if you're an attentive person or a parent, but in anthropology, you learn that what people say and what they say they do is not the same as what they do, right? So we don't have a biopsy for motivations. Like, was they motivated by greed? I certainly don't think so, at all. they were motivated by other sentiments, and very few of them struck me as related to avarice or cruelty at all. That's the painful part, right? These are your friends and colleagues. And so the most I could come up with after all these years of trying for something aphoristic was to ask a question that's much less about motivations and more about social process, right? How do people with our kind of privilege, my kind of privilege, get to be socialized for scarcity on behalf of other people? Like, we wouldn't say, you know what, my mother is not sustainable.
Yeah.
My daughter, she can't go to Duke. You know, she's not sustainable. We just don't do that for, ourselves, and we don't do it on behalf of people who have the resources privately. But why does it come back and hit us again and again like a hammer? Obviously not aimed at us in a way, but it's not greed, it's a failure of imagination more than anything. And that means any of us could have that, right? I sometimes get panicked thinking, what if I had been working in Rwanda in 1993? Right? Because saying you should be working with the government depends on the government, depends on the time. It's great to work with them the last 15 years, right? And then again, when people say, well, how would you work in such and such a place with so much corruption? And I'll say, are you talking about the United States? And that's usually enough to win the argument, right? Because it isn't an argument. And back to the corruption issue. What's corruption? Well, stealing stuff is corruption, okay? But there's industrial level thievery, right? And there's petty corruption. I mean, if we can't make a distinction between some of the scams that we heard about with Wall Street we heard about it after 2008, 2009, but it was going on, right? Or you look at, some of the big industrial level cases in the United States. I don't know much about them, Enron, or I just read about them in the paper, right? That level of corruption is just not something you can see in a place like Haiti where there's so little in the way of staff, space, and systems. So, for example, the pledges that you were mentioning, Dwight, the pledges, well, we had, this organization, Lessons from Haiti, it's really just 4 of us, Jenny's one of them. And so we said, we're going to track this time around pledges made. Here's another thing we did for about cholera. We did it for Ebola too. So you just go to a pledging conference, listen to what people say, and it's going to be a country represented by a person. With Ebola, it was the heads of state, right? Obama was there. And sometimes it'll be the ministers of health or ministers of finance. Sometimes it'll be an ambassador. So they're speaking for a nation. And they'll say, okay, Venezuela is going to pledge this, and the United States is going to pledge that. And then you start picking apart the pledges even before they're delivered, which most of them were not during the Ebola epidemic. Most, right? With Haiti, we had one nation, which I won't mention, but is in Europe and has a lot of divisionism right now, and really good food, paella, who pledged $100 million to fight cholera in Haiti. The Ministry of Health budget, the whole budget, is maybe 30 million, right? There are NGOs with bigger budgets, right? And then they said, hey, we sent the money, and the corrupt Haitians, they were using more diplomatic language and blah, blah, blah. And so I just said, gee, I know the Minister of Health, and I know the Minister of Public Works. Let's find out what really happened. We couldn't even find that the money had ever been transferred. I mean, hey, it's only $100 million, so I'm saying it's kind of corrupt to make promises you don't keep, right? Or you could use a different word. I'm Catholic, so for me, corrupt means something about not rotting bodies. Now, it's kind of corrupt to do that. It's kind of corrupt to say, we're going to send this, and then it was already pledged for something else, or it didn't get sent, or then you say that your interlocutors, stole it. It's a lot of money to steal, and it wasn't stolen, by the way. It wasn't even transferred. Or it wasn't transferred to an account in Haiti at the time we were checking. So, it's complicated, and if there are corrupt national governments, well, what about local governments? What about a town, a county? The way our country's, would you say, gee, I don't like the President of the United States, so I'm not going to work in the United States as a doctor? I wouldn't say that. There's always people to work with.
We have to wrap here because we are coming to full time. But Corey, let me give you the last word here. For you in the process of making this film, what was the most powerful part of it that stays with you as you think about the impact of Bending the Arc and the work that you've chronicled?
Well, there's a part of the film that got skipped over, which kills me as a filmmaker. But Ophelia says that so much of this work is about love. And I think that's so true, and I don't want to just sound so cliche as the filmmaker, but that's, when I was making this film, one of the things I did is I went through 56 boxes of memos that were from Partners in Health from the early days, and they were in the basement of the Countway, which is this, a medical library in Harvard. And I read all of these memos, and it was like, we need to get the drugs from here, and how is Raul doing, and we've got to do that, and we've got to have this meeting and that meeting. And at the end of reading all these memos, I burst into tears because it was like, it was love made visible. Like all of those things that they wrote, and all the time, and all of the decisions, and all of the scheming, and the plans, and the late night conversations, and at the end of it, there was just so much. It's what stays with me is the love involved in not averting their gaze. Jim said recently that that the villains in this film, they're not so villainous. They were just doing what sort of is the trend of the moment. Avert your gaze from this. You're not allowed to see that. So we don't consciously say the emperor has no clothes. This is what we say right now. And so I think that what stands with me is I'm just so in love with these people who didn't avert their gaze when the rest of the world says we don't see that they just consistently had the bravery to see the problem and really address the extent of it.
That's a really powerful and fitting note to end on. Please join me in thanking Corey Shepherd-Stern and Dr. Paul Farmer for your work and this great film. Thank you so much.